Hello. Good evening.
Good evening, ma'am.
Good evening. Nice to have you here, Dr. Femi.
Good evening.
Good
It's nice
afternoon.
that.
Good evening. Nice to have you here. So
Good evening. I
we
hope you can
have
hear me.
what did you say?
I said good evening. I hope you can hear me.
Yes, I can hear you. I hope you can hear me too.
Yes, loud and clear.
Yes. Okay. Thank you so much. We have some people who have already joined us. We have Nifemi Beauty here and Top Fat and Okeme07. They've joined us. Thank you so much for joining us. Today we're talking about cancer. It was Cancer Awareness Week on Saturday. And because it was not a working day, we decided that we're going to be talking about cancer today, talking about the things, all the things people need to know about it, to remove the fear factor. And interestingly, the theme for this year's Cancer Awareness Day is closing the care gap. And we have with us today Dr. Olufemi Ajagun, who is going to take us through, going to talk to us. So be ready with your questions. And it's so good that he's here already. So, Dr. Ajagun, over to you.
Okay. Thank you very much, ma'am. Once again, good evening. Good evening, wonderful ladies and gentlemen present. I am Dr. Femi Ajagun, as introduced, and I'll be talking to us this evening about closing the care gap in cancer. Uh, Basically, it is important to have this kind of conversation because, one, a lot of us will have noticed around us that you see that cancer cases are kind of on the rise. Like it's like there are so many people you just know that have cancer these days. Um, One, it might be that it is on the rise, but we do not have enough scientific evidence to back that up. Another thing could be that we have better instruments of diagnosis now. I'm sure a lot of us would have heard of cases of people who took ill and upon taking ill, they went to several hospitals and yet no reasonable diagnosis or nothing was found to be wrong with them. Some of these cases are cases of cancers that weren't really found. Another reason is because, unfortunately, it is the second leading cause of death worldwide, and that is because, unfortunately, most of the cases of cancers are found quite late, and because they are found quite late, it makes it seem as if cancer is a death sentence. Cancer is not a death sentence. What is cancer? Simply put, I'll just say it's a disease where cells in the body just go haywire. Normally, the body has certain checks and balances to ensure that even though we have cell growth, the cells don't grow beyond certain boundaries. But in the case of cancers, these cells undergo certain changes, and so when they begin to grow, those checks and balances do not work for them. So it affects neighboring organs and eventually distant organs. And but to be able to understand it very well, for those of us who are used to gadgets or having batteries inside of instruments or equipment, you know, leaving the batteries in the equipment, sometimes you discover that your batteries are swollen and they probably no longer work well. If you leave those batteries and you don't take the batteries out, you discover that after a while, the swelling is not just limited to the battery, it now corrodes metals around it. And so, if care is not taken, that particular equipment will not work again. So, the battery, just like the organ that is affected by the swelling, which is, let's say, the cancer, affects is affected and it affects things around it, and eventually the person will not be able to function well. So that is the way cancers are. And trust me, anybody can develop a cancer as long as you have that organ with which that cancer can be formed. anybody can develop that cancer, whether it is a child, which unfortunately uh, occupies like 50% of the cases of newly diagnosed cancers. You find them in children. Uh, so whether it is a he or a she or a it or a they, as long as you have the organ in your body, then you are chances are that one can develop a cancer in that organ. So I'm saying this because I know, for example, in case of breast cancer, a lot of men feel that because they are males, they cannot have breast cancer. It's a lie of the devil from the pit of hell. A male can have cancer, and unfortunately, when a male have breast cancer, the outcome is actually poorer than that of women, and that is the truth. So, what causes cancer? You know, I like to say that cancer really has no known cause, but research has shown to us that there are certain changes that happen to our genetic factors, or let's say our genetic makeup, following interaction with certain uh, external body agents. Like it might be physical agents like ultraviolet rays from the sun. It might be ionizing radiation from machines and all. It might be biological agents like bacteria. It might be like Helicobacter pylori that people have in ulcer. It is one of the most notable risk factors for stomach cancer, like herpes, I mean, human papilloma virus, hepatitis B virus, and all those viruses. Even HIV uh, can be a known agent like that causes it. And in some cases, it might be chemical. For example, like you have aflatoxins. For those who enjoy eating foods that have been there for long and are already growing mold. You know, some people just have the habit of removing the mold and eating the food. Some
Wow.
people will say that the eba of 2 or 3 days that is the sweetest. You know, funny things like that. And not knowing that the mold that they are removing has already released toxins into those foods, so that when you consume those things, they are liable to develop such things, cancers later in the future. In some cases, it's something like arsenic that has poisoned maybe drinking water or underground water from a borehole, or in some cases, rice is one of the one food that contains a lot of arsenic. And so it's important for us to wash rice very well. By the time you wash rice very well and parboil it, usually about 57 or 60% of the arsenic content of that rice would have been washed away. However, there are some rice that have very low arsenic content. I'm not trying to um, promote any type of rice, but we can find that out on our own. So, having said that, I think it's important to quickly run through some risk factors. Yes, cancer has no known cause, but there are certain things that we can do or we can get exposed to that would increase the risk or chances of developing cancer. For example, tobacco use. It is one of the reasons why you hear from time to time that smokers are liable to die young after any tobacco advert. It's very, very instrumental to the cause of lung cancer. Alcohol use, unhealthy diet, particularly when people that take diets that are low in fruits and vegetables, they have they have a high chance of developing cancers. Unsafe sexual practices is a risk factor. Reduced immunity is a risk factor, and we see that with people who have HIV/AIDS. You can People can develop any kind, different kinds of cancers after coming down with HIV/AIDS. Physical inactivity. The funny thing is that you see the quadrant of tobacco use, alcohol use, physical inactivity, and unhealthy diet. These are the four key things that are responsible for cardiovascular disease. Recall I mentioned that cancer is the second leading cause of death worldwide. Cardiovascular diseases are the number one leading causes of death worldwide. And these same four things are risk factors for developing cardiovascular diseases. When age increases too, the chances are that one can develop cancer. Now, this would make me address one myth quickly. Some people think that it is only people who are elderly that develop cancer. It is not true. You find people who are in their 20s, in fact, 50% of cancers, like I said earlier, are seen in children. So it's not a function of age. However, with increasing age, risk factors increase. You might become 100 years in life and not have a cancer in your lifetime, but it doesn't mean the risk is not there. The risk increases with increasing age. And if there is a family history of cancer, infection with any of the viruses or bacteria I mentioned earlier, like hepatitis B virus, hepatitis C virus, Epstein-Barr virus, HIV, you know, all those things are very well known risk factors associated with development of cancers. And cancers can be either solid cancers or maybe the ones that develop from the blood and the blood cells. I was discussing with somebody recently and was telling me that he was asking that how true is it that the blood can develop cancer? That actually the blood is liquid. I had to smile to tell him and told him that at least on the spot I can mention about 6 or 7 different kinds of blood cancers. From the different cell types inside the blood, the white blood cells, people can develop leukemia, and there are 4 different kinds of leukemias. From the lymph nodes or the lymph tissue, people develop lymphoma too. From the plasma cells in the blood, people can develop multiple myelomas, which is very, very aggressive and affects so many things at the same time. There is cancer that is really related to the platelets in the blood. That's the part of the blood that is responsible for clotting of wounds and healing of wounds. So such people will develop clot very fast and all. And there is those that is related to red blood cells. So the red blood cells on its own can have its cancer affecting red blood cells. There will just be too many red blood cells in the system, and it will also be causing blood to clot. Then when it comes to the solid ones, just pretty much name the organ. From the skin to the brain to the tongue to just mention it. Just mention the organs, glands in the body, and pretty much develop cancers. So I would dwell a little more on the commonest ones around us, like the breast cancer. I'm not going to bore us with details of the incidence of breast cancer and all, but I can say quickly that breast cancer is a very aggressive kind of cancer, and implicated risk factors are the presence of certain genes like BRCA1 and co in people who have breast cancer. Another thing we have discovered is that when a couple of family members have had breast cancer, people within that family should be on the lookout, and because they have a high risk of developing breast cancer. Now, as aggressive, as terrible as people can breast cancer, we have had people who have survived breast cancer either by early detection or quick access to healthcare upon detection. Now, some of these things might not necessarily be advanced and all. Sometimes last November, no, sorry, around May last year, 2022, someone was telling me about a particular family breadwinner who suddenly came down with a lump in the breast. Okay, advice that okay, the person should go to the hospital and get some tests done. After doing those tests, and I saw that okay, this thing looks malignant, I advised that the person should see an oncologist. But because of fun and certain cultural beliefs, the person refused to go to see an oncologist. And unfortunately, by December, somebody called me to let me know that the person had passed on. You know, if untreated, the prognosis is sure death. But if you catch it early, the prognosis can be a lot improved. People have chances of surviving for 5 years, 10 years. Even there's a chance of having a cure as aggressive as breast cancer can be. One of the things that is very important when it comes to breast cancer, self breast examination. From time to time, people should look at their breasts in the mirror, whether you are male or female. Look at your breasts. Hope there is no color difference between your breasts. Look at your nipple. Hope your nipple is not unnecessarily darkened. Hope the skin around your breast has not changed. If all those things are not there, well, thank God, it's probably no advanced case. But then, examine the breast. You can develop the breast into four equal parts and examine it quadrant by quadrant, like that. Carefully massage through to check for lumps from time to time. You can do this like maybe weekly or something. Then after checking the four quadrants, you examine the nipple and areola area. Look for lumps. When you find a lump, now there is another myth that once you see a lump in your breast and it's breast cancer. No, that is also not true. Not all lumps. In fact, the number of lumps that you will find in breast that would eventually be cancerous are not up to 20%. They're not more than like 10%, get about. But it is important that once you notice a lump and the lump is there lingering for a week or so, quickly make sure that you see your doctor so that it is examined and we know what it is and get necessary help as quickly as possible. When caught in a stage 1, stage 2, the chances that you are cured, and pay attention to my word, cured of cancer is very high. Self breast examination. Another thing that is important with breast cancer, and not only breast cancer but almost every other kind of cancer, is the fact that if you are able to screen yourself regularly, maybe every 2 years, for women or ladies who are below the age of 25, a breast scan is preferable. Why? Because your breast tissue is still very dense, and so, or chances are, not everybody, but chances are that your breast tissue is still very dense, and so will not give a very good view with a mammogram. However, a breast scan would suffice to pick whatever it is that needs to be picked with such a dense. But for women above 30s, women in their 40s and above, just make sure you do a periodic mammogram check of your breast. And it's not just for the breast alone, it's actually better to do a general or anti-general body check as often as you can. It saves you so many hassles, so much problem. I would quickly want to talk about cervical cancer too, because mention cervical cancer because I know that our time is really not on our side, so I'll try to mention the common ones as quickly as I can. You see, with cervical cancer, that is one cancer that, all things being equal, if we have enough political will, awareness, and all, that is one cancer that should not kill people. Unfortunately, it is aggressive, yeah, but it is one cancer that can be caught very, very, very early. It is also one cancer that you are sure to be able to prevent. You can prevent, before we start talking about even finding it out, you can prevent yourself from having cervical cancer by screening yourself for human papilloma virus. Back in the days, you need to do a lot of smear tests and all to be able to even have an idea that something is wrong. But trust me, these days you can do a DNA test of the human papilloma virus by just taking samples that you can even take yourself. And after that is done, you can now go for more invasive procedures like the pap smear and go to, stage and know what is exactly going on. Well, that one can only stage pre-cancer stages though, but not proper staging. But at least to give you an idea of what is going on and to meet with the blood before it turns out to full-blown cancer. And one funny thing is that this is also a cancer for which people can have vaccines. So that once you check and you see that you are free, you have not been infected by this virus and all, you can just pretty much get the vaccine to prevent yourself from being infected. And most of the cases of cervical cancer have previous history of human papilloma virus infection. So that once you can eliminate that with testing, immunization, vaccination, you are good to go. You have prevented it. Before you now do all these investigations to find out, okay, is it there? Okay, what stage is it? And which really medical screenings, annual medical checks, or maybe biannual medical checks would help you find out on time too. And then once that is found too, it is important that treatment starts early. Once the treatment starts early, then chances are that people will survive. Unfortunately, most cases of cancers do not present with symptoms until they are very advanced. But then some of them present with funny, funny symptoms. You will notice weight loss and things like that. I had a family close relative who sometimes ago complained of some back pain. And because she complained of back pain, I examined, wrote some investigations. She told me she didn't have the time to do the investigations. Eventually, by the time the thing worsened, I told her to see a specialist, an orthopedic surgeon. She went to see the surgeon, and when they did their own tests, nothing was really seen because they were not looking for something like that. Eventually, this woman, a postmenopausal woman, started bleeding. And when she started bleeding, you know, once a woman who has stopped menstruation starts bleeding or seeing her period, it is never a good sign. So they had to refer to the teaching hospital, and by the time we got to the teaching hospital, it was way beyond what could be managed. Even though surgery was done, within 2-3 months, the person was no more. I'm saying this to say that many times all these preventable things, you see that they come out as something that looks like a death sentence, but in the real sense of it, there are things that could be preventable. I mentioned the Helicobacter pylori infection for stomach cancer the other time. A lot of people who develop ulcers in adulthood really should check and be sure of what the cause of the ulcer is. Because some of the things that mask themselves as ulcer in people is actually something much more than ulcer. And please, I need to let you know that no matter how terrible the ulcer is, ulcer is actually treatable. Ulcer is not a chronic disease. Ulcer is something that once you have, see a gastroenterologist, let them be sure of what the cause of the ulcer is, and quickly institute treatment so that you are free of ulcer. By the time human H. pylori infection is left to fester for too long in the body, and so many other things develop in the body, particularly in the stomach. And this is one of the things that is implicated when it comes to stomach cancer. And a lot of stomach cancer cases are not caught on time. In fact, 90% of the cases of stomach cancer I have seen or heard of are not detected early. But you see, for most of them, there is a case of ulcer. A lot of them will tell you, oh, they had ulcer at some point. In some cases, it is ulcer for those that are found early. It is ulcer that is being investigated. They've checked everything, they've done all things. They don't seem to find notification. Then they now go to do an endoscopy before they find out that, oh, this thing is actually beyond the cancerous lesion. Or another common type of cancer is prostate cancer that we see in our men. Funny me, some people think that it's only elderly men that can develop a prostate cancer. That is another lie of the devil. People who are younger can actually also develop prostate cancer. And unfortunately, people who are younger have bad or poorer prognosis with prostate cancer, because a study has shown that if somebody who is, below 60 develops prostate cancer, usually, not all the time, but usually it is the more aggressive form of prostate cancer that they develop. And so the prognosis is usually bad. In the clinics, we do teach younger colleagues that if as a man you get to find out that sometimes in your life you must develop a cancer, you will develop a cancer, but you have the privilege of choosing. Please choose a prostate cancer. Why? Because usually with adequate treatments and all, most of the patients of prostate cancer do not eventually die of prostate cancer, they die of some other things. You see some people develop prostate cancer in their 60s and they live up to their 80s and their 90s, still managing the prostate cancer. But those are people who seek adequate and who seek the help on time. So, having said that about the common kind of cancers we have around, I would like us to, because I think half of our time is spent already, so that we would have time for questions and answers. I would like to quickly move to closing the scare gap. And I was discussing with somebody recently and telling the person that, you see, a lot of times we hear the stories of the people who have survived cancer, but we do not hear the stories of people who cannot survive cancer. People who, those who have died of cancer cannot really tell their story actually. But those passing through it, and theirs is at a very late stage, maybe stage 4, the metastatic lesion, the cancer has spread itself to different parts of the body, and there's really very little they can do about it. Usually you discover that their story is not as hopeful as the stories of so many other people you hear. It is the story of somebody who had aspirations, dreams, who was working towards some things, who had denied himself or herself of certain things, and is hoping to reap the benefits of those things, and suddenly cannot seem to reap those things again. Their case is usually the case of, while so many of us are thinking of the next job to get, the next big deal to close, the next car to buy, the only thing they are hoping for is how to just live for one more day. So because of that, because of such cases, I would like to create time to talk a little more about closing these care gaps, because people go through a lot, and not just the cancer patients go through a lot during uh, care or receiving care for cancer. Both the cancer patients, the cancer caregivers go through a lot during this process. So I'd like to quickly talk about avoiding the disease. You see, in avoiding the disease, like some of the things that I've mentioned, it is important to let us know that, you see, 30 to 50% of the cancers or deaths that arises from cancers are actually preventable. And so it is important that as a people we preach this prevention. As a people we continue screaming this prevention, because you see, we cannot scream it enough. We cannot talk about it enough. We cannot seem to exceed talking about it, because it makes a world of difference. Some of the things we can do, I've mentioned earlier, but you see, you would agree with me that prevention is not just better than cure. Prevention is cheaper than cure. We do not stay in the part of the world where uh, there is enough governmental intervention or political will to support people with cancer. That is the honest truth. So that whatever it is we can do to ensure that we prevent it, and in a case where unfortunately it cannot be prevented, it is discovered early. I think that we should look at those approaches and make the best use of them. Vaccination. I mentioned certain viruses and all now, like the hepatitis B and C virus. You can get vaccines against the hepatitis virus. You can get vaccines against the HPV virus and so many other things like that. Make sure your diet is rich in fruits and vegetables. It is very important. Make sure you do regular checks, self checks, check your check your breast from time to time, both male and female. For males, examine your scrotum from time to time. I'm sorry that I am being um I'm using those words as they are, but it is what it is. Examine your testicles to find out if there is no pain, if there is no swelling, so that if there is any such thing, any difference at all, quickly see your doctor. Then annual screenings or biannual screenings, as much as you can do it. It will help to prevent so many things, because you find out that, okay, you've been exposed to certain things you ought not to have been exposed to. You will quickly do whatever it is you can do to treat it, or at least get rid of such things. From talking about prevention, we would have to move to early detection. Early detection can only be done by screening. Usually, people who find cancers early find it through accidental findings. A lot of time they were not looking for cancer, they were just looking for something else. They were just trying to screen themselves to be sure they are fine. And so once you screen like that and you discover that, okay, this thing is there, please do not despair. I know a lot of people that had the diagnosis of cancer, and the next thing that was on their mind was to take their own life. Some of them actually succeeded in taking their own lives. But by the time autopsy was done, the cancer was actually at a stage where it could have been handled. With surgery and treatment, they probably would have been able to achieve cure, but they're taking their own lives. And those are one of the reasons why it is important for us to talk about closing this care gap, because there is the mental health aspect of dealing with cancer for patients and for family members. For example, most times when as a patient or as a family member, you are talking to people about these things, people, you discover that if you are the type that understand people and their body language, you discover that a lot of times people are not really waiting or willing to hear the stories of gloom and despair. They are looking for a sign of hope. So, having said that, it is very important that we do whatever it is in our best, in our power, to make sure that we detect these things very early and ensure proper management. You don't just find cancer and go to bed. You don't just find cancer and start looking for somebody to sponsor cancer care. Cancer is a big deal, but then as much as it's a big deal, it might naturally not be a big deal if you find it early and you do the right thing on time. Breast cancer, so many other cancers like that. There's so many cancers that if you find them at stage one and stage two, in fact, most cancers, if you find them at the early stages, there is, there is a high chance of cure. Meanwhile, there are some other cancers that, for example, testicular cancer now, even if you find it a little late, but not too late, but like stage 3 and all, there is still a high chance of cure when given proper treatment. So, proper management is important. The management might include surgery, chemotherapy, radiotherapy. It might be just one of the three, it might be all the three, it might be two of the three that the person will need, and there will be cure. But when a patient is diagnosed with things like this, usually the physician or the specialist seeing them has to now plan a goal. Okay, this person now, am I looking to achieve cure? Is it possible to achieve cure in this case? In this case, okay, what are we looking at? If we are not able to achieve cure, can we prolong this person's life? Can we buy this person more time? Say 10 more years, 15 more years? In some cases, okay, we cannot achieve cure for the patient. We cannot prolong this patient's life. Okay, nobody deserves to die a miserable death. So the next step will be to improve the patient's quality of life and help the person to, to palliate or give the person palliative care to support the person so that the person passes on as peaceful as possible. Now, it is in when it comes to things like this that the need for mental health care becomes important. The need for psychosocial support becomes very, very important too, amongst other things. Like I said earlier, we are in this part of the world where, despite the financial burden of this kind of care, we don't see the political will to support people who have this kind of condition. And so it's very important to ensure that as much as possible we make sure that we prevent it, and in a case where prevention is not achieved or the diagnosis is made, just let us make sure that the diagnosis is made as early as possible. Once the diagnosis is made early, I can guarantee you you will achieve cure. As I am speaking to you now, let me permit me to say that by the glory of God, or to the glory of God, because it wasn't by my doing, I I have survived a particular type of cancer that happens. Unfortunately, it does not respond to chemotherapy or radiotherapy, and it was discovered at an accidental finding. I just felt fever, like I had malaria, but the way the fever started suggested something of the urinary tract. because of my training. So I went to the hospital. I had wanted to even treat myself. I got medications and all, but for some strange reason, I just felt like let me not practice self medication. Let me practice self treatment. Let me have a colleague check me up. When I told the colleague checked me up, wrote out some tests. We did the test. Everything came out normal. I made the colleague understand what I was thinking in my head. So the colleague decided, okay, let's do some more tests. By the time we did some more tests, we found something in the right kidney.
Oh,
Unfortunately, renal cell cancer is carcinoma is one that does not respond to chemotherapy or radiotherapy, like I said. So once it passes the stage where surgery is sufficient, there's almost nothing you can do. And 5 years passed. Surgery was done, everything fine. Now, the exact day that I was to leave the hospital, the specialist who did the surgery got a call in my presence from the resident doctors in the teaching hospital telling him about a 21 or 22-year-old girl who was diagnosed of the exact same diagnosis, but she was in her stage 3 or stage 4. And there was the specialist just shrugged that there is pretty much very little you can do, just to try as much as possible to give her a good quality of life before she eventually died. Those are the kind of things we see here and here. Those are the realities we have in this part of the world. And truly, I don't know, maybe these things are as a result of ignorance or certain misconceptions and all. So because of that, I would quickly, before I round up, I would want to address certain myths. For example, some people think that skin cancer now only affects people who have skin. Yes, people who bleach, not light skinned people now, people who bleach have a higher chance of developing skin cancer because of some of the things that they apply on their body. However, dark skinned people too can develop skin cancer. So let's get that facts right. Another thing is that some people think that when a pregnant woman develops cancer or finds out that she has cancer, then there is no hope. It's a lie. Just the right specialist, as long as the oncologist is managing the person with the obstetrician, the outcome can be good, particularly when the case is developed early. So even if a woman is pregnant and develops cancer or finds out about cancer, the woman can still receive treatment. Some people say that cancer will always come back. It's a lie. Cancer does not always come back. I know people who have survived cancer 20 years ago, 30 years ago, and they are still alive. Yes, the chances are that the person might develop cancer later in life. Yes, but the honest truth is that when cancer is discovered at the early stage, I think that's the most important message I want to pass across. When cancer is discovered at the early stage, you can achieve a cure, meaning that it is not a death sentence. You hear some people say all sorts of funny things about the telephone, the cell phones, and all. The honest truth is that the radiations from cell phones are not strong enough to actually change or alter our genetic makeup so much so as to cause any kind of cancer. So those kind of myths are unfounded. You shouldn't go abound with fear of things like this. And some people think that if nobody has cancer, in their family, then that means they cannot develop cancer. That is also not true. Yes, people who have family history have a high risk of developing it. 30 to 40% of the cases of cancers detected are seen in people who do not have a known family history of cancer. And unfortunately, about 60 or 70% of these cancer cases are seen in underdeveloped countries like Nigeria. Deodorants and antiperspirants, like some people say, cause cancer. This is not scientifically proven too. So please, I think that we should not use such lies to start thinking like a he-goat. As much as possible, take care of yourself. Use antiperspirants when needed, deodorants when needed. It is very, very important. Now, having said all this I have said, I usually like to close my talks on health by saying that, see, there is nothing at all in this world more important to you than your body, than your health. If you are chasing money and you want to build, if you like, build a mansion with 2,000 rooms, you can only sleep in a room at a time. If you like, sleep, break the wall between two rooms and sleep across, you only sleep on a bed at a time.
Yes.
If you choose to put two beds together and sleep across, I'm sure it's not going to be comfortable for you, but even if it is comfortable eventually or you manage it, you would only sleep on one side of your body at a time. If you like, have a convoy of 6,000 cars. You can only ride in one car at a time.
Good.
And you see, in all these things that I've mentioned, the the only place that you're going to really spend the whole of your life is inside your body. If you like, say, have a wonderful house, a wonderful car, wonderful office, wonderful places, you would only visit these places part time. You don't get to stay in all these places permanently. The only house that you get to stay from the cradle to the grave is your body. So take absolute care of it. Thank you very much.
Thank you so much, Dr. Ajabu. Thank you. Thank you. Thank you. You touched virtually every aspect that we discussed. And before I start asking questions, my own question. Somebody was trying to find out what HP pylori is. You know, you mentioned how cancer can start from present with ulcer. So that person wanted to know what HP pylori is. So maybe you can shed a little more light on it.
Sorry, is a bacteria. It's called Helicobacter pylori. So for more scientific names or word names, really, we kind of maybe shorten the first one and mention the last one. So H. pylori is short for Helicobacter pylori. It's a bacteria that usually causes peptic ulcer disease. And usually, when peptic ulcer disease is caused by this bacteria, it is actually treatable. The treatment called is a combination of about 3 or 4 medications like that, and you get to use it for a long period of time, and you achieve cure. So I'm saying that now to also let people who are on this call who probably have ulcer and they think that ulcer is one thing that they have to live with for the rest of their life. Please, that is a lie, and try your best possible to see a gastroenterologist. Once you are managed by a gastroenterologist, you will achieve cure. When this thing is left untreated like that, it can actually lead to more dangerous things, and one of which is stomach cancer.
Okay, thank you. You spoke about prevention, especially with nutrition and routine self-examination as it relates to breast cancer. There are so many other types of cancers that one may not be able to check to find out what's going on. So, what would you advise our listeners to do? Because for breast cancer, it's easy when you already know, okay, maybe at a particular time of the month, maybe after your period or around some time, you can do that. But the other types of cancers, how will they know or have an idea that something might be wrong?
Okay, for the common ones that I mentioned, for example, like this, now we talked about that. For cervical, I mentioned that for cervical, you can actually just even prevent it totally so that you don't even worry about it by screening yourself for HPV virus. And once you screen yourself and you find that, okay, you do not have the virus, just go ahead and receive vaccination. Once you receive vaccination, you have totally prevented it. Now, there are so many other tests or checks you can do, which can be routine and can help you discover the cervical cancer at pre-cancer level. It hasn't even become cancer yet, but the lesion is beginning to take a cancerous form, or the changes or alterations that happen that would make it become a cancer have shown. And this you can find when you do pap smear and all, which is one of the reasons why I mentioned annual medical screening, annual medical check. A lot of diagnostics can, do annual screening for you. But if there are certain things you are looking out for, you want to focus on, you can speak to a physician who would recommend the investigations you need to do in this screening. Trust me, most of the cases of cancers that you will find, you will be able to catch with one kind of screening or the other at the early stage. Even the blood cancers, with something as simple as full blood count. Full blood count, yes, as simple as full blood count is. The only thing is that these blood cancers are very, very aggressive, very fast, and that within a week you can check full blood count like last week now, and by the time you check, there's there's a leukemia, for example, or something, or there's a picture looking like leukemia that will now need to be investigated further. So which is why you see that usually, like most HSNs, when we do things like this, we help people to arrange for uh, annual medical screenings. We ensure that those minor things that you probably want to overlook, like full blood counts, is also checked. So once those you check all those things, you see that okay, this thing is happening. Further investigation and try to tackle it as quick as possible. Um, Most of the cancers you want to talk about have tumor markers. So, for example, like prostate now, before the prostate becomes really cancerous, usually it will already start growing bigger, and there are certain signs you discover when the prostate starts getting bigger. Passing of urine becomes difficult and things like that. I mentioned examining the screen too from time to time. For example, when you are feeling uneasy in certain parts of your body, it's just good to just quickly go to the hospital. Instead of indulging in self-medication or just rushing to a pharmacy or speaking to a friend and all that will just give you something to just use to treat the symptoms. Go to the hospital, let them check you properly.
Okay.
So that once you are checked properly, and now another thing I've noticed is that some people who go to the hospital and by the time they mention what is wrong with them, and the doctor starts asking questions, some of them think to feel that some of these questions are private, and so they want to give the doctor misleading information. I'm sorry, let me make this statement on this call. That see, a question as invasive as how many sexual partners do you have has its own implication in medical clerking. Normally, for a patient, most patients are coming to see me as a doctor for the first time. I don't know you. I am not interested in the number of sexual partners you have. So when I'm asking, really, telling me a lie is to your detriment. Because, for example, now, somebody who has multiple sexual partners now, okay, even though the person is not giving me symptoms that suggest HPV infection or something, I might just feel like, okay, let me just screen this person for HPV infection so that at the end of treating whatever it is that it is, the diagnosis we arrive at, I'll be able to counsel this person on maybe getting vaccinated and the dangers of unsafe sexual practices. So, having said that, I believe I have, in a way, answered the questions about how to get the other kinds of cancers as early as possible. Two more markers, annual medical checks. Once you do that in Tanzania, it's yearly. If you are not so buoyant, you can make it biannual. In fact, you can check for a particular batch this year and check for another batch next year. Whichever one you can do it, maybe just alternate like that. Just discuss with your physician, and I'm sure that you'll be able to figure something out. But that is key, and that is one thing that differentiates between cancer becoming a death sentence and cancer becoming an ordinary word.
Okay. You also spoke about the place of nutrition, that it's important to take a lot of vegetables and fruits. Are there foods that people should avoid?
Ah, well, truly, when somebody is already diagnosed of cancer, there are foods that you should definitely avoid because studies have shown that sometimes some of these things aid the growth of the cells, or in some cases, they don't aid the growth of the cell, but they do not help the person to heal properly, or they become antagonistic to the treatment that the person is receiving. So, in a lot of facilities I've had to work on in oncology, I I know that dairy products, as milk and milk derivatives, are usually restricted. The amount of sugar is also now mentioning sugar. There is a round a myth going on that sugar causes cancer or something funny like that, or sugar makes cancer to grow. Yes, cancer cells take up more sugar than regular cells, as cancerous cells take up more sugar than regular cells. But there is really none that has shown for a fact that cancer promotes or makes, sugar promotes or makes cancer to grow more. So we make them avoid dairy products. They are made to avoid food that could contain arsenic. They are made to reduce the amount of sugar intake they get. And food that are rich in folic acid, because folic acid is the major constituent the body needs, or the major vitamin the body needs for cells to multiply. So if you are battling a situation where cells are multiplying rapidly without control, and you are now taking food that contains folic acid, like yams of this world and the likes, then you are just trying to speed up the growth of the cancerous cells.
Okay, so on the issue of folic acid, a lot of packaged food, like maybe Bournvita, some cereals, are fortified with folic acid already. So that means people have to be mindful of that.
No,
Okay.
remember I said that folic acid is for people who already have cancer.
Okay.
Not for everybody. Folic acid is very good. It is good for people who want to have children. It is good for young children as they grow. It is good for everybody, really, for cell growth, cell, multiplication and all, so that our body is well replenished from time to time. Honestly, cells in the body they cannot live for throughout your life. Most of the cells in the body die off at one point or the other, and other cells grow to replace them.
Thank you
So
for that.
for that to happen. So folic acid is not bad for people, but it is not exactly good for people who have cancers. Now, for people who do not have cancers, one of the things that you probably watch eating will be paying attention to your food to ensure that there is no arsenic poisoning, for example. I know that apples, grapes, rice, and all these things, they pick up more arsenic from the soil and other food stuff or plants. So because of that, you might want to be mindful of how much you consume this thing, so that you do not take up so much arsenic into your system and all. But what I think is important for us to do is to ensure that our diet is rich in fruits and our diet is rich in vegetables. Because the reason why is because the fruits and vegetables contain things that we term free radicals. These free radicals are like police in the body, and the things they look out for are certain criminals we call uh, I mean, sorry, I'm sorry. Uh, they contain antioxidants, which are like police in the body. These antioxidants mop up certain criminals in the body that we call free radicals. These free radicals occur from stress, wear, fear, certain things we take in, and all like that. They are part of the things that eventually are considered part of the risk factors for developing uh, cancers, or some of the things that are being thoroughly investigated for the role they play in cancer development. So antioxidants, being that they mop up these free radicals and remove them from the body system, it helps the body to live free of cancer and cancer cells for a long time. That is why it is very good to have your diet to be rich in and vegetables.
Okay. Thank you. One last question. Um, what about the role of family when someone has been diagnosed with cancer? It's usually a very tough time for the person who has been diagnosed and the family. It's always an emotional time. So, how do you advise families to, what kind of advice do you give to families when they find out that their loved ones has been diagnosed with cancer?
Okay, thank you very much for that question. It is a very key question and close to the care gap. When families discover that their loved uh, has recently been diagnosed with cancer or has been diagnosed with cancer, uh, it is a time to rally around that family member and support the family member, not just with funny ideologies and beliefs. Because in some cases, you will hear things like, don't take the person to the hospital. Oh, if you take the person to the hospital and they give the person injection, the person will not survive. Once they give people injection in the hospital like that, the disease will not go again. Funny things like family members will not be the ones encouraging the person to go and try out on herbal medications that have not been tried and all. I think that what is important at that time is that they help the person, they support the person emotionally, they stand by the person and help the person mentally too. Support the person financially because hey, cancer care is expensive, very, very expensive. So supporting somebody with cancer requires financial help, emotional help, mental help because the person needs some form of mental stability. A lot of people who get diagnosed of cancer, one of the first things that comes to their mind is taking their own lives. And I can testify that the same came to my mind. Thank God for my younger brother and my mom who stood by me. If not for those two people, I probably would have taken my own life before finding out that it was at the early stage. Ensuring too that this person gets the right kind of help. This person goes to the hospital. That is not the time for one husband to be thinking of punishing his wife uh, for not being submissive enough or something. No, it is a call for support, absolute support. There's no amount of support given to somebody suffering from cancer is too much. Trust me. Because at the end of the day, if you eventually lose that family member, the support you were able to give will be one of the things that would help you to have some closure, some peace of mind, and not feel guilt. Thank you.
Thank you. Thank you very much. Thank you so much, Dr. Ajagun. I noticed that a lot of people were not asking questions. I believe they were so engrossed with all the things you were saying. Thank you so much. So thank you for joining us. I hope that you'll be ready to answer our call when next we call you. Thank you so much.
Always, always. Thank you
God
very
bless.
much.
And thank you all our participants. Thank you so much for being here today. We look forward to seeing you when next we have another interesting topic to share with you. Thank you.
Thank you very
Bye.
much. I appreciate it.
Thank you. God bless. Thank you so much.